I am Dr. Maxine Jochelson, and I am speaking to you from Memorial Sloan Kettering Cancer Center, where I am the Director of Imaging at the Evelyn Lauder Breast and Imaging Center. We know that mammography alone is not good enough for various reasons. Mammography is a great tool, but the sensitivity of mammography is not perfect, and especially if the woman has dense breast tissue, it's only about 50%. So they used to say that you start screening women 10 years prior to the earliest woman who had breast cancer in her family. And that's about the ballpark, but we pretty much now start screening women at about the same age. So if a woman is known to be a carrier, first when she's young, about 20, we start by having her have regular, just physical examinations. And then we start imaging probably when they're really young, just with breast MRI once a year. And that could be starting at 25 or 30. A lot depends on if mom was 30 when she got breast cancer, we would be more likely to start screening her, the daughter, at 25. So between 25 and 30, we start doing yearly MRI. Then the classic recommendations state that what we should be doing is doing mammography alternating with MRI every 6 months. The problem is, if you look at the literature, the mammogram frequently does not show the cancer. We feel that we need to do something every 6 months, so we continue to do that. But when we look at where we actually pick the cancers up, it's usually on the MRI. Among the things that I have been studying in particular is to do something called contrast mammography. And contrast mammography is mammography done with the same principle as MRI. So MRI finds breast cancers earlier because we give women contrast, and women who develop cancers develop neovascularity, and the contrast will show those vessels, especially because they're leaky, sometimes even before a discrete mass can be detected. Well, contrast mammo does the same thing. It is a regular mammogram. The patient feels like she's getting a regular mammogram, but we give her contrast before we start. And the mammography machine that we use for this has the ability to do 2 images within a second of each other. And then the computer subtracts out the normal breast tissue. And if there is an abnormality, an enhancing abnormality, it will show it, just like MRI will show a cancer. So among the things that we've started doing informally is, rather than do a regular mammogram on these women, if they have dense breasts in particular, we're doing contrast mammo, so that they are essentially getting 2 vascular studies a year. And we're hoping that that will improve our ability to find the breast cancers. Now, there are 2 different mutations, and the 2 mutations are a little different. Women who have a BRCA1 mutation classically don't have cancers that present with calcifications. So you could make a case that you would just do MRI twice a year, and that has been studied. Unfortunately, that's expensive. The insurers are unlikely to do that, and patients hate having MRI. But it is something to think about, because the mammogram in the BRCA1 patients is not that useful. In the BRCA2 patients, they get ductal carcinoma in situ, which can present with calcification. So the mammogram is more helpful. And when you do a contrast mammo, you do get a regular mammo. So in the fantasy, or in the ideal world for all of that, all of what I said, women should start having MRIs when they're 25 or 30. The data for doing mammography in women under 40 does not demonstrate a lot of utility, yet the guidelines still recommend starting at 30 to do the mammograms. But there are a lot of papers that say you could wait till 40. But either way, mammo, 6 months later, MRI, if you have the ability, I know like you do at the Beth Israel in Boston, you can do contrast mammo alternating with MRI, and I think that is actually the ideal situation. What is really interesting is none of the studies that have looked at all the imaging tools have found a value in adding screening ultrasound in the mutation carrier. So we don't consider that part of the routine, just if there is something to look at further on the mammo.